We have now decided that the interministerial panel will be our last panel of the day. We will now take the panel on media, the role of the media in promoting universal health coverage in Nigeria. We'll take that panel quickly while we await the arrival of the Honorable Minister of Health, whom I believe most of us will have important questions for him. So I want to reserve ample time for us to express ourselves before the Honorable Minister and ask our questions. And I encourage you to start articulating your questions now. And when we ask for you to raise hand, you are encouraged to do so. Welcome Bayo Onanoga, who is the Managing Director, News Agency of Nigeria. Put your hands together for him. Mr. Bayo, where is he, please? Bayo. Okay. Let me also welcome Semba Nyage, who is the CEO, Public and Private Development Center. Are you here? Quickly come up stage if you're here. Semba, she's here? Okay, please, a round of applause for her. Let me also welcome our guy at the top, Mr. Dapo Oluro Yomi, Publisher, CEO, Premium Times. Mr. Dapo, please. Let us clap like we are just coming from lunch now. You know His Excellency is the one talking now, not even Ambassador. Thank you. Let's welcome Dr. Ifeanyi M. Nsofo, Health Communications Advisor, Nigeria Health Watch. A round of applause. Join me and welcome also the Managing Director of Daily Trust Nigeria. If you're here, please. Other members of the panel will join us as we progress. Please, the ushers, kindly ensure the mic at the panel are working. I thought I had an oddly. There was an usher oddly given to me. Where are you, please? Please, come. That is my oddly coming. Put your hands together for her. Check if the mics are working. Now, this section, we are going to examine the responsibilities of the Nigerian civil society towards achieving the universal health coverage. It will expand the meaning and scope of our advocacy, especially among key stakeholders. It will also afford us the opportunity to reflect on the types of contribution non-health professionals can make to secure accountability in the process. So we are going to be examining all this, but first of all, I would like to invite our panelists, Mr. Dapo, starting with you, sir. Premium Times, those of us in the National Assembly, I'm aware that my honorable member, once he wakes up in the morning, he goes straight to his phone to check what Premium Times have written for the day. So you have become such a huge influence in the shortest period of time in the media sector. So share your experience with us as to what you are doing about health sector in Nigeria.
Thank you very much. Very simply, what we tried to do as we joined the media landscape 5 years ago was to try to give effect what we thought would be an effective consequence to actually Section 22 of the Nigerian Constitution. And for those of us who are fairly familiar with that document, it says, with regards to the responsibility of the media, that, in short, that it is the responsibility of the media to hold power accountable, to hold the political class, politicians and government accountable with regards to their own responsibilities to citizens. So simply, we just ask ourselves, what will that mean? And so in a sense, we saw ourselves as coming fairly as a critique of the mainstream media ethos in the country. We understand that media can be so many things and it can straddle different traditions, but that if one were to do it in the spirit in which even the Constitution itself understands, and in a way that will help us to help renew the current challenges and difficulties with the media in the country, we thought that we had to do something that was more of an investigative, or what, if you want to summarize it, therefore you will call an accountability media. I think simply put, that's what we've tried to do. Yeah.
Okay, thank you. Please appreciate Mr. Dapo for that. We are just trying to introduce ourselves. Semba is you actually to share what your experience has been in the media trying to play a role in promoting the health sector in Nigeria.
Okay, thanks everybody, and thank you, sir. I work for an organization called the Public and Private Development Center, and we're really a citizens-based organization. And what we do is to empower people to observe and report on the procurement process. And that's because the procurement process is how you acquire public goods, works, and services, including healthcare, including security, education, whatever it is. And one of our focal sectors is actually health, because, of course, it's one of those development indices. It's something that everybody needs. So it's one of the areas that we focus a lot of attention on. But many times what we do is to make sure that we can trace the entire process from the conception of a project right to the time when it gets into the budget, and then to the time when it's tendered for, there's a bidding process, and then to the time when the contract is awarded and there's a delivery. But all of this really, there are so many things that can happen across the stage of the procurement process, and I think it's important that people understand what stage a project is in, because that enables us, and it enables the media in this regard to also I think report more factually. So one of the things that I would say, for example, is that many times we base our assertions on budget estimates. We are very quick to say that a budget estimate is an allegation of fraud, for example, and I don't think that's quite correct. I think that it's best that we can say, okay, it's an estimate. There was an estimate for this, a primary healthcare center, for example, to be built in a certain place. And it's only at the stage where the contract is awarded that we know that the law creates a presumption that, the contract, that money has been released. There's actually cash backing for it. And so without this knowledge, knowing that, okay, so is it just a problem of the fact that maybe we're making estimations, but they're not realistic, and where they're estimates, but they're not realistic, so we can't achieve the primary health care we want? Or is it a case of the fact that the contract was actually awarded, funds were released for it, and it was not, provided for? But I think what is important in the entire loop is the fact that we need information, and we don't just need information at one stage. We don't just need the budget estimates. We need to know when the money goes out, to whom it's going out, the competencies of the person who is going to carry out that contract, so that everybody can report on it. And for people in the citizen sector like myself who do this work, it's very important that we can pass on these kinds of reports to the media, to carry it out and to follow up with the stories in a way that is more effective, in a way that covers the different angles. Because we can also get very hooked on maybe budget estimates or contract sums and stuff like that, but we lose the human angle, the effect, and what's the, what's the effect of
a non-release or an effect of a contract that is not well implemented to human lives. There are stories that are involved in this, and so, I think that's the kind of space that we occupy.
Just a round of applause for her. Hold your thought there. We just have joining us on the panel, Mohammed Suleiman, who is representing the MD of NOUN. He is the head special project. Please, let's welcome Mr. Suleiman. All right, Dr. Nsofo, media advocacy and accountability, strategies to achieving the universal health coverage. What are your thoughts on this issue in just 1 minute?
Okay, thank you again for inviting me. Thanks to the colleagues at the Premium Times. So I work with Nigeria Health Watch. We think we're one of the leading public health advocacy as well as health communications platform in the country. Now, what we do and what we strive to do really is not just for us as an organization to advocate for health, to write about health, to hold radio shows about health, to tweet about health, but really to get Nigerians to begin to take health much more seriously than they do. Because until we get to that situation where Nigerians feel scandalized when, like Comfort shared her story, 17 million naira to treat herself for cancer of the breast. People have quoted what Professor Yusuf said about health insurance coverage, where he made that statement at our Health Watch Forum this year that we held, the first Health Watch Forum, where he said 1% of Nigerians were covered by health insurance after 12 years of NHIS being in existence. But we didn't think that Nigerians were scandalized by that statement. It was as if that was just one of those things again, people moved on. The Abuja airport was closed for 6 weeks. It was as if everybody was going to die, despite the fact that people had alternatives of going to Kaduna. So what we strive to do at Nigeria Health Watch is to get enough citizen participation in healthcare delivery, asking questions, the right questions, holding elected representatives responsible and accountable for healthcare delivery. And so, for example, 2019 is coming. When politicians come, very few people really would ask questions about health. So what are those things politicians are planning to do so that we can hold them accountable? And even when, as CSOs, we're advocating to the politicians to make a case that the politicians would understand, apart from just looking at health as a social service, look at the economic side of it. Look at the political gains that a politician will get if he or she pushes for universal health coverage for every Nigerian.
Absolutely. Thank you so very much. Now, you are a very powerful organ when it comes to the media sector in Nigeria. Do you think we should be discussing this topic, the role of the media in achieving universal health coverage?
Good afternoon, all. I think the question is germane, and it is more than appropriate that we discuss this. And it is equally more than timely that we begin to engage major stakeholders in the health sector. It is against the backdrop of this that the News Agency of Nigeria, in its own wisdom, decided to create a special desk that I have the privilege to head, as known as the Health, Gender, and Population. And so far, so good. We have been involved in a lot of partnership with different organizations. And as he introduced me, I'm the head of special projects of the organization as well. I wear a lot of caps. But for the purpose of this forum, I will certainly just say that I am personally been involved in the advocating for accessible, improved, and qualitative healthcare delivery service in this country. And I'm equally using the responsibility vested in me and the mandate given to me by the chief executive of the organization to ensure that none properly drive this through the 7 platforms that none has at its disposal. So by this, I mean to say that we really need to engage and partner with each other, and we really need to interrogate what is actually happening in the health sector to get it right.
Okay, thank you. Let me go back to Mr. Dakbo. I would like to find out what is your take on the ideal relationship between the media and the health industry or the health sector in Nigeria with respect to advocacy for the universal health coverage. I mean, you're a practitioner yourself, and I'm sure you have insight into this.
Well, truly, it's not going to be too different, sorry, with what a proper media should be doing, and that's why I tried to lay the context earlier. You know, the way the media is structured in Nigeria, and these great champions will speak even better than me, perhaps, on this, is that it is possible that you are just giving anecdotal reference to events, just give a glancing attention to things happening, and you still think that you're doing the job. However, for something so important, for something so meaning to the lives of people, you really need a media, if you like it, let me say, you need something, the conventional plus something. In a way that will be part of what you truthfully will call an accountability media. Let me give some outline to what this should mean. One, of course, you'll be reporting about the key people in the arena or in the sector, the key institutions in that sector, the major events that are happening, but you will then move a little bit beyond and then make yourself, without necessarily glossing or dissolving into that in the sense of a cause, but make yourself a constituency of that issue in the sense that you will say, I'm here to be helping to create solutions to some of those problems. So if someone picks the newspaper or goes to the TV or is listening to the radio, or if it's an internet-based site, it's not just going to be one of those daily horrifying and horrific stories about failure, things that can also demoralize people and citizens from taking action, just as he said. So you see yourself, therefore, one, as an instrument for helping to ensure a kind of vertical accountability in the process that is holding people who have responsibilities to deliver an answer on behalf of the Nigerian citizen, but also in reverse, and I like what my colleague from the Nigerian Health Watch has said, the greatest job really will be galvanizing the attention, helping to funnel the, if you like, anger of the people to take those who are supposed to be doing what they should be doing, but not necessarily doing those things accountable at all times. So for the health sector, what's been missing, I think, and which we made a decision to then go into, because if you look at what Premium Times tends to cover, you see that there's a close attention to health more than any other. We have a very special, dedicated, we have like 4 people dedicated only to health reporting, is because these things mean so much. And there's nothing like saying Nigeria is going to be great if the people are not great. And that greatness must be defined first in the sense of the wellness of the people. So, in a nutshell.
Thank you very much. Let me now go back to Ms. Semba, right? Okay. Are there myths about the universal health coverage that the media helped to promote? Do you think there exists some myths of a universal health coverage you would like to share?
Well, I think that sometimes, and I think it goes back to whether it's investigative reporting or if it's just a feature in the media, I think that sometimes it leaves out, you know, how
responsibility, who is responsible for what, or how health institutions work together. And I think that's something that more attention can be paid to. But I also think, and so I think that it goes back to how dedicated the media is to also accessing in-depth information on the health sector and how they can link it back to people's lives. I think more investigation will definitely help to put things in perspective, and because you're not just reporting for the sake of it, and that would help us to channel, to say, okay, this is the way to go on this, or this is how we can, do this better. And I think that, because I know that, yes, it's good to put things that, of course, you want to gather people's attention, you want it to be sensational. At the same time, you want it to, close the loops, whatever it is that that exist, and make the right connections between the issues that are there. So I think more investigation in the media could help to if there are any myths, it could help to deal with that. Yeah.
Dr. Nsofo, do you share the same?
Yes, and I think just to reiterate again, what is universal health coverage? All people, all means all, having access to the care when they need the care without suffering financial hardships or financial catastrophic expenditure. I have 2 kids, 2 daughters, lovely daughters. One is 8, one will be 5 in November. My first daughter was born a year after we got married with congenital heart defects. She had 4 types. I was a young man, just finished my postgraduate, thought we were going to have an easy ride. 6 weeks postnatal, she was diagnosed with 4 different kinds of congenital heart defects. Wrongly, even in Nigeria at National Hospital, wrongly, because it was when we got to India that we now found out the actual diagnosis. Another private diagnosis center in Abuja also got it wrongly. So for my wife and I, 2 young people that just got married, we did not have money to pay for the surgery. So we had to take loans. I took a loan. I was working with Pathfinder International, and I thank Dr. Mai, who was the country rep then. My wife was working with the International Committee of the Red Cross. She took a loan from my office. My wife proceeded to India while I ran around to get the money and wire. So by the time we finished the surgery, and to know how serious it was, our daughter was born with transposition of the great arteries, with PDA, VSD, ASD, 4 different types. By the time they got back, we were in debt up to the tune of above $10,000. As a young couple, we wanted to save our daughter. She's fine now. The surgery was a success. And it takes me back to what was said during the last panel discussion. Why the media must get every Nigerian involved in universal health coverage is because you do not know when you're going to fall victim. So even if for that selfish reason, you have to advocate for universal health coverage.
Absolutely. Thank you so very much. I'll come back to Mr. Dakbo on this particular issue, because I'd like to get the comment of every media house I represented here on this issue of myths about the universal health coverage. Mr. Dakbo, sir.
So, frankly, it can be a myth, because our starting point ought to be that health is human rights. And human rights cannot be a myth, so it has to be substantive. Indeed, our concern should be greater anger, and I'm not saying, the fury that makes you direct energy in just, as I think Dr. Oji said earlier in the session, just to talk, and rave and abuse everybody as if that's the way to bring solution. But to channel it into very constructive, very serious, universal health coverage is. I'm happy to, I share your passion. Sembe and I were soulmates. I myself just completed a very brutal chemo, and it was very violent. It's probably going to make me bankrupt for life. My surgery alone was $147,000. Where am I going to get that kind of money? But look, life must continue, and people have to. So it's serious. How many people can even? I'm one great lucky guy who just had that kind of an eyeball with luck. But so it's not a myth, and so we have to rephrase it. Health is human rights, and universal coverage is central in the DNA of what we call healthcare.
Absolutely.
It can be different.
Health is human rights. News Agency of Nigeria, do you share this view?
Yes, I think I share all the views, and even more than that, because against the backdrop of about 28 years investment as practicing as a journalist, and coupled with the fact that I managed my mother-in-law for 7 years, and running from pillar to post of cancer, and eventually Abu Zaria Shika became a referral center, and to God be the glory, she is late now, but I think I have a first-hand experience of managing a cancer patient, because she was a resident with me for the whole 7 years. There is no cancer center in Nigeria that we have not visited. And as I said, eventually we ended up in Zaria, and we eventually lost her. So against this backdrop, and I was concerned. So what I started doing when I was a zonal manager in Kaduna then, we decided to float. So I was a co-founder and financier of Journalists for Better Health because of my experience of managing my late mother-in-law and the challenges I recorded across board, as I said. And then when the polio case became, another endemic problem in the country, I was one of those that founded Journalists Against Polio. So I think before the end of this session, I'm going to provide a 12-point agenda for my colleagues that we need to take up the challenge.
Thank you. Thank you very much. Let me stay with you, sir. The media and accountability sector or the health industry, who do you think is more responsible for advocacy for universal health coverage?
The two must partner. The two must partner. Why? Because as we speak, not many of my colleagues know the existing extant laws that guarantees every citizen the right to access quality, affordable, and the quality and health services. That is one. Now, secondly, all the existing laws, and including the Abuja Declaration, not many of my colleagues are aware of the provisions. Now, this is one lack of it, ignorance on the part of practitioners. How do we get out of this? The practitioners, the professionals in the medical and health sector have to team up with the journalists to, begin to advocate for what we are aiming at. Otherwise, we will continue to grope in the dark. We will be groaning, we will be grumbling, we will be complaining, but there will be no action. Now, by the time the two teams, the partner, there is going to be, I expect, an effective, a pragmatic, robust working relationship. On one side, armed journalists with data, educate them on the health challenges. Don't be creative about what is happening in the health sector. Open up, share ideas, empower them with the work tools. Now, use them as the vehicle for the advocacy. And that is where they will begin to take the lead to the doorsteps of critical stakeholders.
Thank you. Let me go to Ms. Semba to know if you actually share in this. What's your take on the subject, actually?
I agree, and as much as universal health is a right, so in itself it's not just going to come to you because it's a right, just like every other right. You either fight for it, you work for it, or something like that. You assert your rights. And so as a country, there's the need for us to say, okay, if this is the ideal we want to achieve, we want to become our reality, every plan we make at every step of the way, is it leading us towards that? So I don't expect realistically that we would wake up tomorrow and everyone has universal health coverage, as we should have, but we should everything that we do, every policy and every practical step we take should actually be leading us towards that, and we should be able to see that it's leading us there. So our budget should be able to tell us that. But the kinds of contracts that come, the use of resources should be able to tell us that we're working towards that. The way we allocate resources for what we allocate it for, should tell us that we're actually working towards that. But it's also an evaluation of how well we do at any given point in time. Because if we're not able to assess ourselves, then we're not going to be telling the truth. So I think we really need to, in quotes, open it to fix it. We can't want to close it from, we have to tell each other the truth, and then we use that to move forward. And so, yes, I also agree with the statement that we have to work together. So everybody, accountability, people working on accountability, the media, we have to work together, feed each other with information, share information, so that, we can move, it's a collective cause, and we can move it forward.
Okay, thank you so very much. Now to Dr. Nsofo, do you think that global health strategies can work in an environment like Nigeria?
Oh yes, I mean, it's not rocket science. If you do the right things, they would work. But I want to hinge it on what he said about data. And I think it's very important for people within the media space to have the right kind of data, the right kind of information in order to energize Nigerians to demand for better health care. There is something that is called national health accounts that is done periodically by the Federal Ministry of Health in different countries, supported by WHO and partners. What it simply means is they will look at the total health expenditure, the total money available for health, and say who is responsible for what. Now, for me, the sad aspect is that if you look at the national health accounts for Nigeria, out-of-pocket expenditure, what you and I spend for health, is responsible for almost 70% of total health expenditure. And the donor community that we all rally around are responsible for about 4% of total health expenditure. So who is the king here, really? You and I, the patients, the people who go to procure health. So what he also tells me is that Nigerians already are spending so much for health, and in most cases for substandard care, spending so much money to do that. And there was a survey that was done in 2013 to look at the willingness to pay for health insurance in Nigeria. It's about 92% of people across the country were willing to pay for health insurance. And so the question now is that why is government not tapping into this opportunity? People are spending more than any other procurer of health in Nigeria, and people are willing to pay for health insurance. But despite that, 1% of Nigerians have health insurance after 12 years, and after the government had spent almost 350 billion naira through the national health insurance. We should be scandalized.
Thank you so very much. We should be scandalized. Hold your thought there, sir. I think that an important question, if today we achieve the universal health coverage, what do you think will be the strategy? And every member of the panel will have to say something on this question. What will be our strategy for demanding for sustainable accountability?
You know the interesting thing, and I think Professor Adewale said it yesterday, that universal health coverage is not a destination. It's a process, it's a route you're taking. So we can get to a situation where almost everybody has universal health coverage. However, issues will still persist. Issues around quality of care. Issues around patient-centered care. I'm a doctor. I've been a clinician. And to be honest, a lot of my colleagues and other health professionals can be quite rude to patients. So how do you now do in such a way that when a patient gets to the hospital, the patient realizes that he is king? When we do trainings for health workers, one thing that we tell them is that no matter how good your hospital is, no matter how passionate you are about your work, if no patient walks into your hospital, it closes down. So issues around quality will persist. It's about rights of patients, drugs procurement. How come in Nigeria, every teaching hospital procures their own drugs independently? Why can't you have central procurement by the Federal Ministry of Health? When you get down to the state, why can't the State Ministry of Health procure centrally so that you can negotiate for lower cost? At the end of the day, people pay, less for healthcare when they go to access healthcare. So issues will persist, but we have to be open, again, as the media, to be the vanguard for the people, to continuously hold government accountable and mobilize the people to push for their rights. It is the right of every Nigerian.
Thank you. Ms. Semba, issue of sustainable accountability.
Well, as it relates to strategy, I would agree that you can always look at healthcare from different aspects. So, from my organization, we would always look at the procurement process. How efficient is that process, and is it actually delivering value for money, or are you giving people what they want? If what we need in this community is more of drugs rather than a new healthcare center, we'll be looking at those kinds of things. But even by the time you look into a system and you look at it dispassionately, or you look into one system like the procurement system, then you would also see that the procurement system in itself will not fix everything. So you start to look at issues around, it has to be a holistic system. And I think that the Bureau of Public Service Reforms very recently, carried out some kind of survey or study, where they came up with some of these things. You have to look at issues around, just as Dr. Nsofo has said, around staffing, the quality of the patient's care there, drug supply, all those kinds of things. But when you look at one, it allows you to even eliminate what is not wrong and see what needs to be fixed, because sometimes the things that we even think may be the problem may not in themselves be alone, or something else is interfacing with that. So it's an environment really, and in an environment there are lots of different factors. So our willingness to open up the system to scrutiny so that we can see various systems could be a good strategy.
Thank you very much. Mr. Adapo, please.
Well, yes, we'll all just be re-emphasizing ourselves, but I think in structural terms, the point that I think Dr. Nsofo, so I'm just going to emphasize that, is to say that if you take one institution that's been given the power to define itself in terms of what it needs to be doing in society, the media certainly is. And that's the whole meaning of the Section 22 that I spoke about earlier. The fact that the media is not doing this in fidelity is the failure of that institution, and we have to find a way to devise with what is currently wrong with our media. The popular saying that democracy deteriorates only to the extent that the media deteriorates is very true, and certainly more true in Nigeria than any other place. For us to fix health, we must fix health journalism, because all this craziness happening that we're talking about and we're so all angry about is because systematically on a day-by-day basis, one institution that's been given the power by the Constitution to hold people, the institutions, and everybody in that ecosystem responsible, they're dropping the ball. So we have to, so that blame is there. But again, civil society, it's also, the advocacy is a definition of civil society in one way. So if the media if it will do its work in fidelity, you still need a complementary support for civil society actions to do the kind of great things that Ronsi and many of the people in the PACFaH coalition are doing, and many others. But at the end of the day, accountability truly, truly belongs to citizens. It's only when the citizens are all truly empowered, they can galvanize the media, galvanize the civil society itself. It cannot be something that we really put at the shelf and pick at convenient time. Everybody must be ready.
Thank you.
To
Thank
push
you
this.
so very much. Mr. Suleiman, I think we should appreciate Mr. Adapo. Mr. Suleiman, I know you have something to add in a few seconds before we
I
go
think
to the
that
audience.
the question begs more than a minute to answer. Why? Because from what we have been told yesterday and today, my summary of it is this. We have been informed of the challenges. We have been informed of the way forward. But I somehow beg to disagree with some of the speakers, including the Honorable Minister of Health. If we really want to achieve universal health coverage for all, as encapsulated by the World Health Organization, as contained in the Abuja Declaration, as it is also envisaged by the National Health Act, then it must be a destination, not a process. If you say it is a process, it's an escape solution to get into what we want to achieve. And that is why I beg to disagree with the Honorable Minister. If we really want to achieve that, we must fix it as a target. This is what I want to reach. But if we say it is a process, then I think we have a long way to go. It is going to be a very windy journey for us to get to that destination. So in summary, what I have discovered is that there is lack of political will to get us to where we want to be. I have also identified lack of serious commitment by critical stakeholders. And the last thing is that what we are witnessing in the healthcare delivery sector, the inter and intra-fighting is also a serious setback. So we need to address this as they come our way.
Okay.
Thank you.
Please, a round of applause. Thank you so much. I think
Good afternoon, distinguished ladies and gentlemen. I stand on all existing protocols. I'm Tony Okpeliero, mental health advocate. We are talking about national health dialogue, health for all. And we know health encompasses both the physical and mental health. And mental health is an area that has constantly been ignored. And I just wanted to find out from the media what you are looking to do in promoting mental health generally, not just mental illness. I mean, I want to commend the cancer survivors that came out today. 3 years ago, we had a conference in Lagos. The World Mental Health Day is on 10th of October every year. The theme that year was about schizophrenia. We could not get any Nigerian with a mental illness, with a diagnosis of schizophrenia to come out. And I'm sure you all know the answers. I don't have to ask you why we couldn't get a survivor to come out, or someone with a lived experience, as we call it, to share that. So I'd like the media and also the help. We need policies to work hand in hand to look at mental health. It's really key. A couple of weeks ago, we're all aware, a medical doctor jumped into the lagoon in Lagos. They said it was due to depression. A 19-year-old guy, student in Babcock, committed suicide in his home. I could go on and on, but what I'm saying is that we have to prioritize mental health. So I'm using this medium to appeal to all that are involved, the media, the policy formulators, those in the legislature, those in the Ministry of Health, and commissioners for health as well. Thank you very much.
thank you so much. Honorable Commissioner is just behind. Just give to him, then we'll come out.
Thank you very much, sir. Gentleman from Nan, I actually heard what the Honorable Minister said. I was actually taken aback. I think maybe he'll be coming, I hope, later on this afternoon. I think what he was conveying was exactly what you said, because that must be the ultimate aim, universal coverage. It is not the process. What we're doing is the process, strengthening the health system, making sure that our health centers work, and the ultimate aim is universal health coverage. So that should be the case. Dr. Nsofo, I'll be glad to know the methodology and the demographics of that survey that you did that said 92% of Nigerians are willing to pay. The reason I'm saying this is I was privileged 12, 13 years ago, before the NHI started, to have been on a committee that was led by the then head of service, Babal Yayale. And I was representing the chief medical directors in the country. And we had a struggle with the union, trade unions, about starting health insurance. There was so much resistance at that time. But I'm glad to say that the committee we have, which is broad-based now in Nasarawa State, the representative of the trade unions were open to it, saying, come on, let's get on with it. But I would like to know, because I'm saying this because I come from a state that I think we still need a lot of mobilization. So it would be great to see where that the demographics came from for this particular information that you have provided to us.
Thank
now,
you, sir.
Please, sir, may I just say one thing? You see, I think the press still has a great responsibility. Many people will pay when they go to ASEC service, but as we rightly said, there are results. Even if you are rich, you will feel it. But the issue is this. we talk about government. Government must take the lead. But every one of us must be part of that contribution. And I think that is the issue. Because often we think that it's government who will provide. Government must provide. And therefore, we need to sensitize the community to the point where they realize that, yes, government has a responsibility, but we also need to do our part. And we must take it in the way we're taking the issue of tax. How many Nigerians want to pay tax? Even the rich ones. Okay? So it's important we also address it in that context. And because for many of the things that we have been told, or we have been talking, it's from experience. And therefore, it was a privilege to hear your own experience. Because when you go through a certain experience, it makes a difference in terms of your passion and commitment to it. So we need to go in that direction. Thank you, sir, for your understanding.
Thank you, Honorable Commissioner. You know you are in the next panel with the Honorable Minister himself, so you'll be ready to take from this side too, sir.
Suppose I just say thank you. Is that okay? Okay. I just want to make sure that I don't even use the 1 minute. When Amaka says that the health is not within the justiciable corridor in our constitution, she's of course right. But as an aspiration, we cannot stay at that point. Health is human right. That means we then have to fight for it. It doesn't mean that it's substantive, it's meaningful yet in Nigeria, but it's an aspiration that we have to fight for. That's what we do about everything that is right. And I really share the Tony's point about mental health. Yes, actually, my colleagues are in another hotel. We're doing some training for journalists on psychosocial health. So, of which is a major problem even in the profession itself. So I totally agree with you, and except you help people understand that that will be. And we came to this by just noticing what people do when they are covering Boko Haram situation. You really need to see a journalist who is covering Boko Haram, and you'll know what we're talking about. I'm not talking about people who are covering it from Maiduguri. People who are really covering the thing. So that's very thing. But you know, the point which I think is very important and probably the most substantive to me is the point that Dr. Oji made, and which I think also Professor Dan Iam made, is the fact that the journalists can really create a lot of good in society. But it's like the educator in every instance. The educator himself has to be educated. I agree upfront that a lot of what we're trying to write about in Nigerian journalism today, we are not at the point of literacy, let alone of knowledge. So it's a collaborative effort. If you own the media in the society, then you really have to put. Why is this the case? It's because there's a structural crisis in the media in this country today. That crisis is defined by a failure of ethics on the one hand and a failure of revenue to even manage the media. It's a long story, so it's not for here. But if you don't solve the the revenue problem in Nigerian media, it cannot then address the ethical problem, which is sad enough. But this is not the point to address that. But I agree that through partnerships, capacity development initiatives, and so on and so forth, this will go a whole long way in trying to solve the problem, especially in an area technical and so important as health. We must create conditions for education that will help the journalists to improve.
Please, an applause. Let's have Ms. Semba just a word, please.
Thanks very much. And I just wanted to maybe speak to the issue around working with journalists from the onset. And I'd like to say that several accountability-related organizations like ours are trying to do just that. We have an initiative called Budeshi. Budeshi means open it in Hausa. And we have a website, budeshi.ng, where you can see contracting processes in the health, education. We have several contracting processes over there, and so you can trace it from conception till it's award and then to public service delivery. And we use these to go to communities to check what's going on, and there are a few journalists from here who have gone with us for some of these engagements, and we hope that it kind of like gives you an idea
we come from one angle. You probably, have a better picture of storytelling and putting this within the media space, and we're willing to do a lot more of that as we move along.
Thank you so very much. Dr. Nsofo, please.
Okay, so in response to the Honorable Commissioner, that survey was done by the Center for Health Economics and Development, CHECOD. It was a willingness to pay survey. But I'm also not surprised that the labor that you engaged with for health insurance were a bit skeptical, because there's an issue of trust. Niger State mentioned here in the morning that the past administration had withdrawn people's money from their salaries for health insurance, which never, took place. So labor is a bit skeptical. They want to protect their own constituency before they agree to things like that. In terms of the training of journalists, we do that. We have a project for universal health coverage that is supported by Christian Aid Nigeria, and we train journalists to help us to write about, such issues around universal health coverage. And we're talking about putting the stories. For us, we write about just health. So, if you want to find out issues about health, we do that, and we do it very well. For mental health, as Nigeria Health Watch, we're very passionate about it. I think our blog piece last week was on mental health, and it's something that we do and we do regularly. Lastly, we did a survey with NOI polls on emigration of Nigerian doctors. 9 out of 10 Nigerian doctors we interviewed want to leave the country.
Thank you very much. Please, a round of applause for our panel. And I invite the panel to please stand for group photograph and continue to clap for them. We have had a very productive section. It was very insightful and very, very rewarding too. So thank you so very much for sharing your knowledge, and we encourage you to continue to do the good work. Right now, we will now go to the final section where we are going to discuss the issue about health sector financing, experiences, challenges, and the way forward. And we expect the Honorable Minister of Health who will join us, but right now being represented, and he will join us for the closing ceremony. Let me quickly invite, are we having a good time? Are we learning something? Are we being motivated? Are we ready to do more? So together we win. All right. Join me as we make welcome Professor Isaac Adewale, the Honorable Minister for Health, who is here represented. The representative, is he here? Please come to, thank God he's a young man. Clap for him. We are making progress. Where is my orderly? This bag is not for nothing. Come and hold it. Please appreciate the representative of the Honorable Minister. I'll get his full details and then recognize him in his own right properly. Let me also welcome to the panel the Honorable Minister of Finance, or the representative, Mrs. Adekemi Adeosun. The representative, if you're here, kindly come to the platform. Let me also welcome distinguished Senator Udo Udoma, or the representative, the Honorable Minister for Budget and National Planning. If you're here, please kindly come up. Let me also welcome Dr. Habiba Lawan, the Acting Secretary to the Federal Government, or the representative. If you're here, please kindly come. Let me also welcome Dr. Daniel Enya, the Honorable Commissioner for Health, Nasarawa State. He's my friend. Please clap for him. His Excellency is just an honorable, so I appreciate him as he's coming. All right. Let me also welcome Mohammed Jamil Zakari, the Honorable Commissioner for Agriculture, Nasarawa State. Please put your hands together for him. I know he's around. Where is he, please? He's coming, right? All right. Let's also welcome the Commissioner for Budget and Planning, Nasarawa State. Is there? Is he, Prof? Okay, put your hands together for the Honorable Commissioner. Okay. All right, please appreciate the representative of the Honorable Commissioner of Budget and Planning, National State, Mr. Abdul.
Very much. My name is Dr. Ebanji Filani. I'll be representing the Honorable Minister of Health. I think it's a very germane topic. I think it's important that this should be discussed and brought to the court of public opinion. The way the Honorable Minister has looked at it was upon resumption of duty. He had a look at data, right, to understand how government had typically been expending in healthcare. And what we realized, right, very early on was that only 2.2% of government expenditure, right, as a percentage of total government expenditure was going to health, public, right? And the challenge with that is that when you compare it to, like, say, 10% that you see in lower middle income country, you realize that that is very low. But that's not because it started today, that's historically, and that's what we're seeing as the trend. So government expenditure, right, or prioritization of health at the public level has always historically been low. The implication for that is that you would have more people, you and I, paying out of pocket, right, for healthcare service delivery. And of course, for those who are the poorest amongst Nigerians, there's a higher likelihood that that pushes you further into poverty. And then that cycle that you have, that virtuous circle, has implications on how the country in itself is able to grow economically. And so realizing that, and also on one hand, looking into where government, not just at the Ministry of Health, but government as working with its partner, where government has invested in healthcare, there has been tremendous results, right? So if we take, for instance, the issue of malaria, and we look at how well we've, focused on ensuring that we scale up the and the use of nets, we're seeing significant increase in a 10-year period. At the same time, you're seeing significant increase in outcomes, right? So reduction in prevalence within the period reduction in prevalence of malaria within a 10-year period has dropped from 47%. Has dropped from about 42% to 27% within the same time frame. So recognizing this, what the minister did was to, of course, write to his boss, who is the president, and the president decided to set up what you have, which is what we're talking about, an interministerial team made up of health, Ministry of Finance, Ministry of Budget and National Planning, and a group of other MDAs, right, to look into how do we finance health even more. So there were two main issues. One was how do we raise more funds for health and what opportunities exist for that. But more importantly is even when we raise them, how do we utilize those funds effectively? Because at the end of the day, the outcomes is what counts. Government needs to know what results I'm getting, particularly in a fiscally constrained environment in which we're working. And I think with respect to, like, if you compare like challenges and values that we've seen or the strengths of that, I think the challenge typically with such committees is that it's not been as, in terms of like regular meetings at that level has not happened as much as they would have loved it to. But the value has been tremendous. Last year alone, right, between last year's capital budget for 2016 for health and compare it to this year's budget, it's over 70% increase by just having that interface between not just the Ministry of Health, but also being able to engage more properly with the minister being able to engage more effectively with his counterpart in the Ministry of Budget and National Planning, and also his counterpart in the Ministry of Finance.
Okay,
I think
Dr. Banjo, we'll discuss that interface more.
Right,
Let's just go to Dr. Daniel. What is your take on this topic and how relevant it is?
Thank you, sir. It's very obvious that interministerial collaboration is critical to health generally. And I mean, you can't talk of nutrition without involving my colleague there in the Ministry of Agriculture. 2 weeks ago, about that, I was in Maraba carrying out some assignment that was related to my office. And somebody just came running to me and said, please, please, you know, our abattoir here, you know, the kind of thing that comes to our abattoir, if we tell you, you won't eat the meat there. But I have actually been there, and there are issues. And I said to him, it's not directly under us, but I'll make sure that the Commissioner for Agric, you know, will take on that. But we need to collaborate, whether it's environment, whether it's health, money that is needed. And in fact, I will go beyond interministerial, various levels of government. I mean, my colleague just stood up and asked how many were from the National Assembly. And, you know, there wasn't there. I'm glad that the chairman House Committee is here. And we reach out. It's so important that you reach out to all the people, all the stakeholders and all the people who have responsibilities in terms of health, whether it's funding or whatever. And that is absolutely necessary. And that has been experienced in Nasarawa State. And I would recommend that we do that. And even at the federal level, between the Federal Ministry of Health and, you know, the Commissioners of Health, that is critical. Somebody did ask earlier on whether the once a year, you know, Council on Health is adequate. And often, you know, it's all done rush. And, you know, it becomes you know, a show, and you don't have much time to interact. But I believe that the Honorable Minister of Health is making an effort towards increasing the relationship between the Ministry of Health and the state ministries of health. But lastly, I think also at the ministries level, because we need to lead by example at the federal ministry level, we need to lead by example. The statistics that we just mentioned would not encourage any state governor to put in much money if at the federal level that has been done.
Yeah,
thank you very much.
Thank you very much. Budget and plan in Nasarawa State, right?
Yeah.
What has your experience been?
Well, I'm very happy to be part of this noble occasion. As part of our experience in Nasarawa State Ministry of Finance and Economic Planning, we used to be known as Ministry of Budget and Planning, but now Finance and Economic Planning. And part of our responsibility towards this particular discussion is that at our own level, we have a committee of food and nutrition that is domiciled in Ministry of Budget and Planning and now Finance. We coordinate activities of all nutritional activities in the state, and from time to time we invite the relevant stakeholders in this project to discuss on the way forward. And thank God with the effort of PACFaH, which have built capacity of some of these members from various line ministries, the nutritional activities has been scaled up seriously in Nasarawa State. And secondly, in all the health-related issues, you will discover that in 2016, the budget was a little bit low, but in 2017, we have been able to increase their budget because of the advocacies by UNICEF, by PACFaH, and some others. So we are trying our best. Thank you.
Okay, thank you very much. Mr. Mohammed, you are in the most prominent and important sector that is relevant to health, agriculture. What has been your experience?
Thank you very much, Mr. Moderator, and my colleagues. Agriculture is very relevant, very important. If you're talking about health issues, they say health is wealth, and of course, if you're talking about health, you're talking about people feeding properly for them to be healthy. So agriculture is essential, is important. The Honorable Commissioner has made mention of the interministerial collaboration that is between us, even budget. We have a food and budget, what do you call it, nutrition committee, which my director of home economics is part, and there has been a lot of collaboration between health and agriculture and of course commerce. But basically, the question you ask is whether or not it is important for us to finance the health coverage and health sector. I think from what the representative of the Minister of Health has mentioned, there is not sufficient funds that is provided to health and even to agriculture. Some of these critical sectors are not given the support that they need. So obviously, we need finance. A lot of money needs to be injected into the health sector. It needs to be injected into agriculture. And a lot of collaboration need to be scaled up so that we will have a healthy nation. No farmers, they say no nation. And you can see where we're coming from. And food security is essential because whatever it is you want to do to get the kind of citizens that will drive the economy and every other sector of a country, you need them to be well fed. And that is why this agenda of food security is essential. And so agriculture is at the center of health issues. And I can assure you that from the point of view of what Nasarawa State government is doing in this direction is the realization that the current executive governor is indeed interested in ensuring that there is what we call incremental slice of the budget insofar as health and agriculture is concerned. And this is going to continue. And I think it should continue across the board from the federal, state, and local government levels.
Thank you very much. Dr. Mustafa, Niger State, what is your take, sir?
All right, thank you very much. My own take on this, just to add the importance of this topic by saying that I was at a conference in India a few years back, and one of the speakers there said that every minister is a minister of health, and that until people realize that, we'll not be able to tackle our health issues. Like the Minister of Water Resources is also a Minister of Health, because when people do not have access to pipe-borne water, they will fall ill. The Minister of Agric is a Minister of Health. If there is no food security and people are not eating healthy and they have no access to food, they will be ill. The Minister of Defense is also a Minister of Health. When there is no security in the nation, conflicts all over the place, the health sector will be the one to bear the brunt. When people are being kidnapped, people are being traumatized, they go into all kind of mental stress, and also that affects the health sector. If the Minister of Education is also a Minister of Health, but if people, we all know the importance of the relationship between education and health status. When women are educated, we know that they are they better able to take care of themselves, go to hospitals, know what they need, they are more educated about their health issues. If the Minister of Housing also is also a Minister of Health, if people do not have good homes that are not built in terms of following the standards, people living in overcrowded houses or do not have shelter, they will definitely fall ill. If the Minister of Power also is a Minister of Health, if there are no power, no equipment, we cannot power our equipment, we cannot do ultrasound scan, we cannot do so many other things in the hospital. The Minister of Transport likewise, and the Minister of Works. If we do not have roads, people cannot have access to come out and to go to the facility, which is one of the second delays of the 3 Ds. When there is no road network for you to even go to access the hospital, that is also a challenge. When there are no good transport system, when there are lots of accidents and so on and so forth, there will be a lot of problems. The Minister of Environment, if our environment are also not very good, will also have health issues. And then also the Minister of Finance, who is supposed to finance all of these other sectors. And if these sectors are not financed, they won't be able to do very, very well. And then eventually, people will not be healthy. The Minister of Labor, if people are not empowered, people are not employed with the high level of unemployment that we have, if people are not employed and they cannot pay for their healthcare services, we'll have a lot of challenges in the Ministry of Health. If we don't take care of the issue of people who are the labor, if we don't care about their health insurance and so on and so forth, we'll also face a lot of challenges. In medicine, they refer to this as basically the social determinants of health. So the importance of intersectoral collaboration cannot be overemphasized. Earlier today, I gave an example of in Nigeria, we know that the primary health care is basically under at the local government level. And apart from the fact that we have a good collaboration between I and the Commissioner of Local Government in my own state, we will have been faced with a lot of challenges. Lastly, I also want to add something that is very important. Collaboration at all sectors, at all levels is also very critical. PACFaH, one of the sponsors of this program, last year invited me for a meeting in Kuru, Jos. Now that meeting, we realized that they invited, because of the issues in trying to improve the healthcare budget, trying to ensure that the Abuja Declaration of ensuring that 15% of our health of the budget is allocated to health. We realized something. I brought up an observation that they didn't invite enough members of the state assembly. And after that meeting, they promised that they will come to our state, Niger State, and they will help us organize a meeting of the State Assembly members to educate them about issues of budget allocation and ensuring that budget reaches up to double digit, preferably 15%. They did that in Niger, took the whole 24 assembly members to Lagos, had a 3-day retreat, and because of that singular act, two things came out of they doing that. One is that our budget was increased by the State Assembly. They promised that they would increase the budget to double digit, so it has been increased this year from 7% to 12%. And then secondly, so we'll give kudos to PACFaH for that meeting. Then secondly, the speaker picked interest in the issue of health insurance scheme, because he never came to his head, to his mind, how if people have access to a certain pool of funds, that it will reduce this out-of-pocket expenditure. Now, because of that, right now, currently, the speaker, the program he is running for the community, or it's his local government, Chanchaka local government, which is Mina, he's providing free health insurance scheme for the people of Mina. And then he's also our champion for ensuring that we get a bill passed for our health insurance scheme, which we hope to do that by October. So collaboration and educating people cannot be overemphasized.
Thank you so very much. Amazing experience in Niger State. Let me come back to you, Dr. Banjo. You are in the national level. What has been your specific involvement in health sector financing over the last 3 or rather 2 years or more? Because I know this administration is just over 2 years.
Okay, thank you very much. Let me just very quickly respond to 1 or 2 comments that was made. I think the value in the conversation I was trying to lead up to was not so much as to the historicals in terms of how poor public expenditure has been. I think more so is using that data to ensure that we could have the interministerial committee, but more importantly, what we've been able to get from the interministerial committee. And I talked about 2 things. One was that we were able to increase between 2016 and 2017 our capital budget for health for about more than 82%. And I think that's important, right, to put on the table. I think secondly is the fact that we're better able to even understand the fund flow at the finance level so that we in health can better plan how, whether it's your procurement or how you want to engage generally. So I think there's value in that. With respect to your questions, I will look at it from a number of folds. One on primary care and some of the work that we're doing on tertiary health institutions. At the primary care level, the minister said it not once, not twice, a number of times, that the primary care is considered the gateway or the gatekeeper, and it believes that it is the platform upon which we should build a proper health system. For us to be able to do that, it is important that it is properly financed. And how do you do the financing? It's taking it away, it's looking at it at the entire ecosystem and asking yourself, what role, right, would your financing play? With regards to what I do, because I assist the Office of the Minister in financing, is that I'm involved in all the analytical work that would that underpin some of the healthcare revitalization program that we're doing. And specifically, also I've been involved in some of the immunization work on health financing. But I think more importantly, beyond the individual, is how are we leveraging, using all of this data to leverage more resources? And that's what we're saying, not just leveraging through government, domestic resources, but also being able to showcase the need for partners to be able to contribute more. And I'll give you an instance. With a push for the Basic Healthcare Provision Fund, for instance, through the data that the minister has been able to share and the vision that he has put forward, we're seeing already, right, the partners are already contributing into that fund. And I'm sure that Niger can speak to that. The goal is to have a startup phase of this program within the next 2-3 months, and then move forward from there. I'll just leave it so that others can take questions.
Thank you so very much. Let me ask, particularly our commissioners that are here. The commissioner for Niger